Morning to all. So we have what topic left in that? There is anything left? Yeah, we have that topics. Nervous system. Correct. So which is the smallest part in the brain? Which is the smallest part in the brain?
Sir,
Which is the smallest part in the brain?
sir,
Hello.
sir.
Yes, yes.
Can you hear me? Yesterday you gave some question scenario.
Yeah, yeah. That
So
answer I will explain it
today,
later.
okay, okay, okay.
Thank you. Thank you. So you can take the starting of the nervous system. Page number 451. So smallest part in the brain. Smallest part in the brain is pituitary gland. So pituitary gland is the smallest part. Okay. This one theory question coming in exam. Next. So starting of the nervous system, we have skull, meninges, brain. Here and all procedure will do. So if they are doing skull, meninges, brain, then we have to come in this pages or we have to take. So what is mean by meningitis? What is mean by meningitis? What is mean by meningitis?
Inflammation on meninges.
Inflammation of meninges. So meninges present in the which place? Meninges present in the which place?
This cover of brain.
Covering layer of the brain and spinal cord, not only for brain and spinal cord. If meningitis question coming, you need to select the brain and spinal cord. Brain and spinal cord, both you need to select. Okay, so you need to know that because that is one of the important medical terminology question. Meningitis. Next, we have injection, drainage, aspiration. They're doing injection into the skull. Okay, so injection, drainage, aspiration, collecting the fluid. So we have the code 610002 61070. 61002 61070, book page number 452. Directly you can look in this header injection, drainage, aspiration. I'm going to give two questions. You can take. So ventricular puncture through previous burhole, implanted ventricular catheter. Second one, puncture of shunt tubing with radiological supervision and interpretation. Okay, so please take that two answers. Under the header, injection, drainage, aspiration. So it is easiest one in down that header you can look. Okay. So first one is 61020, second one 61070, and also you have to give for the 7 series code also. That is for the radiological supervision and interpretation. Puncture of shunt tubing 61070. Radiological supervision and interpretation 75809. Okay. So everyone clear this? Second question, you must give the 6 series as well as 7 series. Okay. So next we have for the twist drill burhole trapane. That is also direct under the header twist drill burhole trapane. You can look directly and you have to take 61105 61253. In between, directly you have to look. Page number 452. No other guidelines. Directly you can look the book and take. Here and all sometime questions coming, direct questions. Okay, please take this. Okay. So directly under the Twisdell Burhole Trepane header, you need to look and you need to take. Okay. I said sometimes from this header also questions coming. But this is a direct question, not much guideline in that. Okay, I'm giving first one 61105. Second one 61154. Third one 61120. Fourth one 61108. Any doubt? I will give yesterday's I share. I say last I will share. While doing the last time, last minute I will share. The next we have the craniectomy and tomy. So in the skull, some portion they are removing. That is for the craniectomy. Tomy also incision. So in that time we have to check for the it is performed to the supratentorial or infratentorial. Supra or infra. Supra means above. Infra means below or under. See that one done in the below or under it is infra. Supra means above. Skull above means supratentorial. So what all parts comes under supra or infra means frontal, parietal, temporal, occipital. Frontal, parietal, temporal, occipital. This all comes under supratentorial. Okay, cerebellum, brainstem, posterior fossa, medulla, spinal cord. Cerebellum, brainstem, posterior fossa, medulla, spinal cord. This and all done, it is infratentorial. Frontal, parietal, temporal, occipital, it is supra. Cerebellum, brainstem, posterior fossa, medulla means infratentorial. So we need to check it is for supratentorial or infratentorial. That procedure performed to frontal, then what you will consider? Procedure performed to frontal mean what you will consider? Frontal means supratentorial. Yes, correct. Frontal means supratentorial. So like that, we need to conclude based on the location where they are doing. Okay. So page number 452 starting via craniectomy. 61304 is the starting. N code is 1576. Page number 454. 452 to 454. In between, you can look the code sets, descriptions, and exactly and what I'm going to give two questions. You can select from this starting code to end code. Okay, I given here. Please take Guys, first one for the 1 second. So which code having the brain tumor? That code you can select. Checking code exactly having brain tumor. That code you can select for first. So first one 61510. Second one 61520. First one is 61510. Second one 61520. Any doubts? Anyone?
Sir,
Yes, yes, yeah. Tell me.
sir, how can I lead in alphabet, sir? This question. For directly under craniectomy, removal of tumor, sir.
Yeah, yeah. Craniectomy under tumor brain. You try like that. But sometime you will not get this and all exactly code. You will get some code ranges. You have to confirm with the tabular list only. Okay.
Okay, sir.
Craniectomy, you can search craniectomy under tumor, brain tumor, or cerebellopontine angle tumor. You will get. Okay. So
Sir, when
next,
we have used 61304, sir.
said you don't have the brain, correct? So 304 is they not mention anything brain. Cranectomy told me for the exploratory supratentorial. They are searching exploratory means finding out that is the exploration like that. But here not, you don't have the excision and also brain tumor not having. Okay, 61510 only we have the brain tumor exactly. That this one that what that method and all they will mention maybe phone flap or something until they will give in the question itself. And another question is asking doubt in the 61518 and 520. 61518. One second, guys. One 518, it is for the cranectomy for excision of brain tumor, infratentorial or posterior fossa, except cerebellopontine. Except, except mean it won't come. So I given X cerebellopontine. So 61520 is the correct. Then next we have for the surgery of skull base. Please look the surgery of skull base notes once. Approach procedure, definitive procedure, and repair and reconstruction. So inside the skull, page number 454 and 455. So inside the skull, want to do some procedure. they need to open the skull. That openings happen in which place? It's anterior, posterior, middle. Inside the skull, want to do some procedure, first need to open the skull. That is for the approach procedure. And once open the skull, inside what doing? Either repair, biopsy, or excision. That is for definitive procedure. First need to open the skull, which approach. Definitive means once open the skull, inside what doing? Repair, biopsy, resection. That is called the definitive. And once open the skull, need to close. That is for the repair and reconstruction. So approach, definitive, repair and reconstruction. See, so page number 454, 455. See, so one doctor, doing approach, another doctor doing definitive, another doctor doing repair reconstruction. So three doctors involving, they are doing one doctor approach, one doctor definitive, one doctor repair reconstruction. Code each doctor separately what they done. Code each doctor separately what they done. That is for the one concept. And suppose one doctor, one surgeon involving all three procedure. One doctor doing all procedures mean you can code definitive procedure is first because that is bill amount is high. So definitive procedure first, then approach procedure with 51, then repair reconstruction with 51. Because this approach definitive repair reconstruction bill amount more is definitive. So that definitive code I'm giving first. Then less value CPTs. Okay. So this is the way you need to approach definitive repair reconstruction. All procedure done one doctor definitive first, then approach with 51, then repair reconstruction with 51. Suppose different doctors involved. So what they done code each doctor separately. Okay. And do not append 62 modifier with the surgery of skull base. 62 is the one modifier, two surgeon modifier. That modifier not applicable to the surgery of skull base. Don't append with the surgery of skull based codes. Okay. So you are taking approach or definitive. Commonly we have the word anterior, middle, posterior. Definitive also same anterior, middle. What exact procedure you have to think and give the correct answer. Please remember one doctor involving all procedure you need to code separately with 51 modifier. Two different doctors, three different doctors involving code each doctor separately what they done and do not append modify 62. And mainly you need to check for the it's anterior, posterior or middle that locations. Okay, so please check. I'm giving one question for this related what I explained. Based on that you can take. So in this options, you have to eliminate. I said one doctor involving only 51 modifier, but here two doctors involving. So 51 modifier is it won't come. Correct. Then do not append 62. So A and B it won't come. We have C and D only we have. C and D options only we have. So in that C and D, Dr. Martin, how will you report? Question. So Martin done for the excision at middle cranial fossa. So excision at middle, which option having middle mean? We are checking, you will come to know. The correct answer is 1606. That only middle. Everyone clear? But many people selected A answer. Why you selected A? Clear now or still you have doubt?
Sir, can you explain about modifier 62 once again?
62 is there two surgeons. That modifier don't append here I said.
So with this series, we don't have to append a 62.
Yeah. Surgery of skull based procedure don't append.
Okay, thank you.
Okay. So next, I'm moving for the epidural steroid injections. So I'm giving the notes. Please check. You can search under injections
Sir,
epidural or anesthetic
hello,
agent
sir.
under epidural.
Sir,
Yes.
sir, can you please explain again modifier 51?
What?
Can you please again modify 51, sir?
No, 51 I said in the note itself they given one guideline and one surgeon involving. Page number 455. In that, if one surgeon performs more than one procedure, approach and definitive, then both codes are reported, adding modifier 51 to the secondary additional procedures. That only I followed. So one doctor doing multiple procedures like approach and definitive because both are different headers, different procedures. So approach and definitive done multiple procedure concept so that we are using modifier 51. Okay.
Sir, can you hear me?
Okay, sir.
Yes.
Yes, they're having doubt in like 62 modifier. Like for surgery, here the question also they involve the two doctors, right?
Okay.
So why we are not using 62
That
modifiers?
only I said clearly we have CDR coding desk reference in that clearly stating. So this
Okay.
approach and definitives and all we need to code separately what they done. Okay, don't use modifier for 62. So in notes itself clearly mentioned don't append 62 modifier. Apart from actually two surgeons involved and completing one procedure. Surgeon involving
Okay.
and completing one procedure only 62. But here two surgeon involving, but they are doing separate. One separate approach with one doctor doing, another doctor doing definitely no, then how it will come? It is not together, right? Doctors
Okay, sir.
involving, some they are doing separately different kinds of procedure. One is approach, another one is definitive. Okay, so that only we are not using. That's why I mentioned do not append 62 modifier here.
Okay, so can you explain like what is approach, like what is member approach procedure, what is definitive and what is repair and like that?
Not listen now before
No, sir. Like approach means like just
where they are in the
uh,
skull need to open which place they are opening.
okay, just
That is
opening.
approaching to open the skull. Opening is the approach, and inside the
Okay.
skull maybe repair, biopsy, excision, something inside what doing, that is the definitive. Then closing is repair and reconstruction.
Like anything like exit. What's it like repair or reconstruction? Can you explain again?
First they are opening skull, right? That opening is the
Yes, sir.
And inside, once
Oh.
open the skull, inside maybe some lesion removal, biopsy or tissue taking, something inside what doing, repair or whatever. That is called the
Okay.
definite. Once open the skull, need to
Okay.
close or not?
Yes, yes, close. I have to
Again, have
close.
to. That is called reconstruction.
Okay. Okay, sir. Clear.
Sir, I have one doubt, sir.
Yeah.
Sir, in this question, two provider involved, sir. One provider is performed, another one is approach, sir. Why we not code to code, sir? There is no option or any specific guidelines, sir.
No, 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 no. In question is what? Whom need to report? Question is what? To asking for the to report the Martin service. Question is
Yes,
please
sir.
report the Martin. Martin, what he done? You can code that alone. They're asking, they're not mentioning anything. You can code both service. Now you can code both. But question is, how do should report Martin service alone? They're asking for Martin service alone need to report. Understand?
Okay, sir. Sorry, sir. Sir, if won't mention Martin service means we code two coda, sir.
Yeah, yeah. But that time also definitely they will have to mention because two doctors involving, right? Definitely they have to mention any one doctor or both doctors. Now then
Okay.
A doctor one code, B doctor one code. You can. Okay. So next, epidural steroid injections. So injections under epidural or injections under vertebral epidural, like that you need to try. Okay. So first you can read the notes, look the codes. Everyone go and check inside the book. Please try this. Read once this note. Guys, epidural steroid injection. Epidural steroid injection 62320212223. Epidural steroid injection 62320212223. Epidural steroid injection without image guidance, cervical thoracic one code. With image guidance one code. If lumbar sacrum without image guidance and with image guidance. And in your question, epidural steroid injection mention, if they mention continuous catheter mentions cervical thoracic, then 62324. And without, with the means 62325. And 62326, it is for without image guidance, lumbar sacrum. And 27, it is for lumbar sacrum with image guidance. So continuous catheter mention these 4 codes, otherwise first 4 codes only. Here you need to check for the levels. Levels you need to check cervical, thoracic, lumbar, sacrum, and single or continuous with or without image guidance. Okay, please go and check the codes. What page number this codes and all present? Okay, 466. So here I'm giving
Sir,
one
can you
question.
repeat again, sir?
What
The level.
the notes, right? In that I mentioned we need to check the levels. It is cervical, thoracic, lumbar. Then single or continuous. Continuous na below 4 codes. Second 4. If not continuous mention, you can go with the first set of 4 codes. Then with or without image guidance. Things you have to look while coming with the epidural steroid injections. Yes, 62322 is the correct. 62322 is the correct. This is for epidural steroid injection. Okay. So look, cervical, thoracic, lumbar, sacrum with or without image guidance, then you can go directly and you can find. Then we have for the transforaminal injection, vertebral transforaminal or anesthetic agent under transforaminal. You are searching, you will get. Transforaminal steroid injections same thing we need to check. It is cervical, thoracic, lumbar, sacrum. 47980, it is for cervical, thoracic. 48384 for lumbar, sacrum. So this point first you have to check. This is what location. Okay. Then need to check for the level, single level or each additional level. How many levels? If I'm telling L1, L2, L3, L4, L5, like that mention one question. Epidural steroid injection, sorry, transforaminal steroid injection performed to L1, L2, L3, L4, L5. Now, each bone is one level. So then how many levels L1 to L5? Each bone is one level, I'm telling. So L1 to L5, then how many levels? 5 levels. Okay, 5 levels. Suppose T1 hyphen T2, come on, T3 hyphen T4, come on, T5 hyphen T6. Like this mention in between. So hyphen in between they are giving. T1 hyphen T2 in between giving. T3 hyphen T4 in between given. T5 hyphen T6 in between given. That means in between hyphens only you have to consider levels. Then how many levels in this? 3 levels. Okay. So you need to know how to calculate the levels. Here 64479 is the first level. 64480 is the each additional level. 64480 is the each additional level. First level, then each additional level. So first level and each additional level. Cervical, thoracic, first level, second level, and lumbar sacrum 64483 is the first level, 84 is the each additional level. See, this is for the levels and codes transforaminal. See, together they are given means you need to calculate in between how many are there. Then how many levels it will come? T1 to T6. In between means how one T1 is there and T6 where it is. Then how it will come 1. But we need exactly what hyphens. Okay, T1 hyphen T2 like that given now. You have to think hyphens only can consider.
3 levels.
T1 to T6. You can tell clearly how they are given. If T1 hyphen T2, T3 hyphen T4, T5 hyphen T6 like this given now, it is the 3. Otherwise T1 in between, then it will come 5 levels. But everything we need exactly, but what you given, it won't come. It won't come like that. See, I think your question is wrong. You have to give correct question, and then we give the answer. Next, transforaminal steroid injection examples I'm giving. You can try this. Please take the answer. Okay. So first level, each additional level. Okay, like that you need to take. So 6448384 into 2. 6447980 into 2. Any doubts? Because first one is 3 level. Okay. And here also 3 level. But location is different. Any doubts? Okay. Next, last we have for paravertebral facet joint injections. Please read the notes, paravertebral, everyone. Please go through the notes. Everything I given in the notes. Please read once. Okay, so paravertebral facet joint injection. Injection vertebral, paravertebral, you will get the code. So 64490 is for the single level. 91 it is for second level. 92 it is for the third or more level. So you know well how to calculate the levels. So you need to give the first level CPT, then you must give second level, then only third or more. First level, second level, third or more. Okay. Then cervical thoracic like this, lumbar sacrum 644939495. If CT or fluoroscopy guidance using means you need to go for the 6 series code. Okay. If that imaging guidance not used 20552 and 20553. 20552 and 20553. Then ultrasound guidance used. They're not using CT fluoroscope. They are using ultrasound. You need to go with the T codes 0213T, 0218T. This the starting code, end code. Okay, CT or fluoroscopy using mean 6 series. Imaging guidance not using 2 series. If they're using ultrasound, then T codes alone, not 6 series code. Please remember only T codes, temporary codes alone. If ultrasound. If bilateral procedure, use modifier 50. Okay. So down I given 3 questions. Paravertebral facet joint injection L1, L2, L3, L4 with CT guidance what code? It is 6 series code it will come. And L1, L2, L3, L4 with ultrasound mean T codes it will come. And trigger point injects paravertebral facet joint injection means no image guidance 2 series code. Okay, please try these 3 questions. Everyone. So you need to give the first level, second level, third or more. Third or more mean only single code is enough. No need to increase the quantity. Because that is third or more. First level, you must give the second level, then third or more. Okay, I given the answer. First one is 644939495. So first level, second level, third or more level. Then ultrasound guidance means T codes. First level, second level, third or more means first level code, second level code, then third or more level. Then paravertebral facet joint injection L1, L2, L3, 20553. 20553. Okay. So everyone clear? So I consider for three levels, three muscle I considered. So that I selected 20553. Guys, everyone clear? Then yesterday I given questions, right? So that answers you can give quickly. Some 6 questions I given, right? So from your side you can give in 2 minutes. Then I will share my answers. I will explain that too. Please check.
Hello.
Yeah, tell me, tell me.
Sir, how to search code for cubital tunnel release in alphabetic index?
Okay, you can go and search neuroplasty. Under cubital mean it's related to the elbow. I given one picture, right? In notes also. Cubital means what? I showed that one. So cubital means it's related to the elbow. Cubital means this is here only present. So it
Okay,
is the elbow. Elbow it will come in this. Carpal mean wrist it will come. So neuroplasty under elbow, nerve at elbow, or neuroplasty nerve at wrist for carpal. Like that you need to take.
okay. Thank you, sir.
Okay, I'm giving the answers. You can cross check. First one 62258. Second one removal of CSF shunt 62256. Third one neuroplastic carpal tunnel release 64721. Then neuroplastic cubital tunnel release 4718. So carpal means wrist. cubital means elbow. You need to search neuroplasty elbow, like that. Then hearing conduction, bone conduction under, you are searching, you will get the code 9710. The last one 62252. Okay, so in that answers, anyone having doubt, you can ask me now. Okay. So this
Sir,
direct questions, and this 6 out of, you will get at least 1 or 2 questions in the final exam.
small
Definitely this
request, sir.
yes, yes.
Sir, kindly send me the your class video record on daily basis, sir. It will helpful to revision in the evening time. Free time.
I'm sharing daily basis.
Actually, last week 1 or 2 days missed it, sir.
No, all
22nd.
class I'm sharing, it is there, but you can come on session one, you can come and search it there. I'm sharing, okay.
Okay, sir. Thank you, sir.
Okay. Okay, guys, this much only today's session. It's over 6 series.